and welcome to this audio podcast. As part of a Meteor edition. This audio podcast as part of a Biome bullet. And this audio podcast as part of a Lobostic Phantom. This audio podcast as part of a Storm Lobostics production. In this audio podcast, sort of going back to some works from in around 2016, where this where research poster presentation works was presented was had been presented within the remit of the International Paediatric Nephrology Association, or the International Paediatric Nephrology Association in around 2016. The poster presentation was collaborative works in sort of collaborative works with some added novelty in where collaborations or collaborative effort was part of the works as part of the works. The research poster presentation looks at can social media reduce discrimination and ignorance towards patients or healthcare service users with long-standing conditions, and using a chronic looking at chronic kidney disease as a long-standing condition example, and also looking at works looking at sort of discrimination and ignorance in line to and in context of those with disabilities, persons with disabilities. So the collaboration was not had some novelty in that there was a collaboration between the RPSG, the Renal Patient Support Group, the RPSG, the National Commission Persons with Disabilities, the NCPD, a collaboration with health excuse me a collaboration with health informatics and data disability, one voice coalition for accessible information communication technology, and also a collaboration with the kidney disease and renal support group, or KDARS, and renal support group, or KDARS group for young people KDARS group for young people with chronic kidney disease, or CKD. The KDARS group. The collaborations in this works sort of unified a way to sort of highlight or inform of some in around some of the literature, but also align with the literature align with the literature some important some important questions linked and aligned to some of the sort of methodology aspects of this works. So to begin with, then a little bit in regard to the aims. So the aims of objective of this collaboration, of this works and this collaboration was to identify the use of to identify if the use of social media can help raise discrimination and ignorance awareness for people with long-standing conditions or long-term conditions, and again utilizing a CKD, a chronic kidney disease example, and aligned to aligned to an effort with those with disabilities, and using assistive technology for people with assistive tech for those with disabilities, and to highlight the sort of some of the perceptions or perspectives through the social media platform, the RPSG, as one of the main sort of social media platforms. So a little bit of background. Patients or healthcare service users with long-standing conditions sort of account for sort of 50% of primary care appointments, 64% of outpatient or clinical appointments, and where literature has informed, in around 70%, almost 70% of admission into hospitals, for admissions into hospital for varying aspects of healthcare services, and around 70% of total health and care, or healthcare sort of healthcare in context of healthcare services in line with the NHS, for example. NHS, the National Health Service, has been attributed is attributed to people with long-standing conditions, and those with disabilities. People diagnosed with a number of long-standing conditions tend to be sort of the in part sort of where at least where evidence or literature has informed, has tend to be the sort of intensive users in aspects of healthcare services, because the requirements, the needs and the requirements are usually more complex, or there's more complexities than those with with sort of single based illnesses or diseases. And most people aged sort of 65 or over, in as far as literature, as far as context in literature, have multimorbidity, can have multimorbidity. And although a investigation had found that absolute number of people with multimorbidities was higher, or has been is higher, that is high in those aged under 65, indicating also its implications for the population as a whole. According to Article 1 of the United Nations Conventions on the Rights of Persons excuse me, on the rights of persons with disabilities, the UNCPD, persons with disabilities can include those who have long-term physical, mental, intellectual, sensory impairments with interaction with various barriers, which may hinder full and effective participation in society on an equal basis with others. And the UNCPD, in at least in this works was linked to works by from the UNCPD from in around 2006. Between 2010 and 2030, it has been estimated that the number of younger adults, the number of younger adults with learning disabilities, so those aged between 18 and 64, will increase by 32 point, just over 32%, just over 32%, just over 32% from around 220,000 to around 290,000, and the number of younger adults with physical or sensory impairment by 7.5%, around 7.5% from 2,900,000 to 3,100,000. So furthermore, the rates of disability have been increasing due to the population aging and increases in long-standing illnesses amongst other causes, and at least according to literature and some according to literature and documented evidence from the World Health Organization from 2013. So a little bit in regard to discrimination and ignorance in context. So discrimination is thus defined as distinguishing sort of the differences between treating someone as inferior on their ethnicity, their gender, their health background, national origin, age, or other characteristics. And according to the UNCPD, UNCPD, discrimination is defined as any distinction, exclusion, or restriction on the basis of disability, which has the purpose or effect of impairing or nullifying the recognition, enjoyment or activity on equal basis with others of all human rights and fundamental freedoms. It includes all forms of discrimination, including denial of reasonable accommodation, according to the UNCPD from 2006. Ignorance in context. So relating to discrimination is ignorance, which is a basis of being uninformed or having a lack of knowledge, and this means sharpening focus on human rights, upon discrimination and ignorance as actually experienced by people with disability or long-term or long-standing conditions accordingly. One way of improving the awareness of discrimination and ignorance for disability or long-standing or long-term conditions for employers, for example, and service users, providers, policymakers, and healthcare professionals, is pointing them to the information and resources where they can gain real experiences and understanding. This can be achieved through information and communication technology, or ICT, and sort of ICT that is associated or linked with social media. Now, a little bit in regard to living with a disability. So across the world, more often than non-disabled peers, people with disabilities do not or have not received healthcare they need, and have poorer health. Persons with excuse me, persons with disabilities tend to report more access to healthcare problems than persons without disabilities. These problems tend to be most common amongst those with the poorest health, and those with those with most severe disabilities. And there has been a sort of there has been varying evidence works amongst the literature sort of from in around the sort of the earlier parts of the new millennium. And according to works from 2006, it is imperative that healthcare and policymakers, planners, and providers understand and address the needs of people, the needs of people with disabilities as a distinct category of healthcare service users. People with disabilities are more than twice as likely to find healthcare providers skills and facilities inadequate, nearly 3 times more likely to be denied healthcare, and 4 times more likely to be treated inadequately. The World Health Organization, WHO, Global Disability Action Plan Global Action Plan sort of guidance or evidence from between 2014 and 2021 sought to address disparities. The right to receive the highest attainable standard of health without discrimination on the basis of disability is enshrined in Article 25 of the UNCPD. Apart from being a right in itself, the right to health and work is also important in that it primes people with disabilities and long-standing conditions to lead active to lead to lead and participate in amongst the population, and in amongst society. So now looking at living with a long-standing condition or long-term condition, and using CKD as an example. Excuse me. So CKD is a long-standing condition that essentially has been described as sort of the gradual or usually permanent loss of kidney function or renal function over time. Early in the disease process, people with CKD, chronic kidney disease, often experience no symptoms or symptomology, and for a long time, CKD has also been an underdiagnosed condition amongst populations, or amongst varying populations. At the same time, the effect of CKD of individuals or healthcare service users, and the resulting society burden that ensues from the long-standing condition, or effects of the condition is or has been attracting some scrutiny in amongst the literature. The emerging data point of the emerging data point to an urgent sorry, these emerging data points, or data points to an sort of point to an urgent need or requirement for global effort to highlight that CKD is preventable. The sort of symptomologies are modifiable, and treatment can and the treatments can improve outcomes. Analysis of healthcare service users or recipients with unidentified CKD in amongst the literature suggests also the risk profile may be different to patients or recipients with identified CKD, and this is an area of focus that requires further interrogation, further investigation. Now, in this works, there was some basic or sort of data collection that formed part of this poster presentation from 2016. So now a little bit in regard to the methodology aspects of this poster presentation. So a discrimination and ignorance thread was posted on the RPSG for 1 month between excuse me, between September 2014 and October 2014, inviting members to post comments and views to help answer the following questions. Number one, have you ever had any discrimination or faced ignorance against you? Number two, to what extent? Number three, is this something you can? Is this something you have had with CKD or before? Number four, do you find that there are inequalities and indifferences because of the long-standing conditions or any other reasons? And question five was, is it through work? Is it through work? Is it through work or outside? Or outside. So as part of this, as part of this work, poster presentation works, the RPSG, just to highlight a little bit here, the RPSG is a non-funded social media platform which is and was founded by 2 or 3 individuals in the southwest region of the United Kingdom, and unlike other social media platforms in regard to where renal is or has been concerned, the RPSG is also or has been sort of a research focused, so or a research focused or research active, and the RPSG has 10 or 11 members who formed the administrative and research team, with representation from the United Kingdom, Europe, and at the time at the time, Australia and the United States, who were responsible for moderating the social media platform. At the time of the RPSG of this poster presentation, there was or had been in around just over 7,000 healthcare service users globally, sort of supporting each other, with members providing insight on lived experience and shared decision making. Since the RPSG mainly it had mainly been a social media platform through Facebook. This initially lent itself well to raising awareness and allowing members to share experiences and sort of lived stories. So all RPSG members at the time were eligible to participate, to post comments relating and regarding to discrimination and ignorance. The RPSG has a disclaimer which relates to consent, and requires that members are aware that they are welcome to contribute in any data collection, studies through the social media platform. If anyone felt uncomfortable, if anyone sort of felt uncomfortable, uncomfortable, anyone felt uncomfortable being involved, they didn't being involved. They did not have to post any comments. Clear information about this works was made available, and member privacy and confidentiality was protected, keeping comments anonymized. All existing RPSG members were able to access and contribute or participate through the through this through this through this 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 through this investigation. So the RPSG in around the RPSG's perspectives, there were several comments over 30 comments, and sort of basic sort of analysis helped derive two main themes. So there was a theme in around lack of awareness, education and understanding, and there was a theme in around disease sensitivity and healthcare service user or patient sort of experience. So here in as part of the analysis, a little bit, I will look to highlight some of the comments, and again, these are all anonymized, where I'll look to highlight a few comments on these on some of these as part of the two different themes. So in regard to lack of awareness, education and understanding, so one of the comments was, yes, there is a lot of ignorance out there. Even with the awareness, I faced various ongoing obstacles, even with family members as well. Absolutely. And there was a comment in regard to, I have found it hard in the past looking for work and having to work around dialysis slots, dialysis times, lack of understanding and knowledge of what renal failure is, and because physically where this where the participant informed that lack of understanding or knowledge of what renal failure is, and because physically they did not they mentioned that they did not look unwell. And people think that there can be that there's an over exaggeration, and it's not always strangers. It's family as well. The one of the comments sort of additional comment from the participant was one of the best comments. Sorry, one of the best reactions as part of their experience was do you have was in regard to do you have to go in where in referring to in-center dialysis treatment, or hemodialysis treatment, for example. Do you have to go in? It's a bank holiday, or it's a Christmas, for example. Do you still have to have dialysis? And whether the participant said, as part of their comment, as part of the comment, after 18 years of being through the particular condition. Another comment, or another comment was, I wouldn't suggest discrimination, but I feel that implies an intention of being mean. However, I'm sure my peer group simply don't understand what CKD means, despite the attempts at educating them. And then another comment here was is lack is or is and was around lack of knowledge or awareness that leads to ignorance and discrimination. But to some extent, I would agree. I would disagree with being mean. And discrimination also equates to inequality. So basically, if you have a long-standing condition, you are a certain race, color, or a certain age, certain height, and you'll find it a challenge to one, progress, two, lead a decent life, and three, be viewed as and three, be viewed as an equal, or sort of open quote, close quote, normal, whatever that means. So now some of the comments in regard to disease sensitivity and healthcare service user experience. So I think it's quite interesting that on sort of applications for most openings where the participant had commented in regard to work, have applicants to tick various boxes. But this is actually more unfair, because employers can technically see more of the applicant's background, and thus there could be a selection bias in recruiting in work, etc., and leading to indirect discrimination. I don't see the point in all the extra sort of tick boxes. Another comment was, I think it varies in nature from country to country, and also organization to organization, as well as amongst individuals. My guess is that humans are essentially tribal, and have natural tendency to favor their own, which I suspect is by definition discrimination. Another comment was, worse treatment by insurance companies for something for which you bear no fault or responsibility is certainly to form of is certainly a form of discrimination is certainly a form of a discrimination according to a comment by one of the participants. And then another comment. I was told by a former manager the reason I didn't get a promotion that they didn't get a promotion is because they were sick, and they thought they couldn't handle it. And after they had informed them sternly about after the participant informed sternly about their rights and ability, and clarified the sort of ins and outs of the Discrimination Act, they swiftly got they swift they swiftly got they swiftly got a promotion and a pay rise. But thought where the participant had thought that the manager that their manager at the time was 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 being was or had a sort of a discriminatory a sort of discriminatory a sort of basis. And finally a comment here. I'm that A final comment from one of the participants who informed that they had suffered from being bipolar, and even and had been very discriminated against for that. Even even these days, people are just cleverer at doing it in subtle ways. The participant then says that they work to combat discrimination against healthcare service users. Now, finally, just looking at some aspects of assistive technology. So there are a range of initiatives to highlight discrimination and ignorance through information leaflets, online peer support, one-to-one and group educational sort of initiatives. Initiatives at the same time can be initiatives can be categorized as a continuum, with passive information provision about sort of healthcare service users, conditions, and technical skills at one end of the spectrum, at one end of the spectrum, with technology with technology that aids to support at the sort of other end of the continuum. So one of the questions one of the questions as part of the research poster presentation collaboration was how about assistive technology to preclude or raise discrimination and ignorance awareness. So a formal definition a formal definition or basis of assistive technology, at least in the United Kingdom, had been informed had been informed by the 2001 King's Fund workshop, where the organization, the King's Fund, informs that any product or service, any product or service designed to enable independence for disabled and older people. Uh, and the passage for individuals with Disabilities Act, the Disabilities Act, at least where Disabilities Act had in part had a link with the with a in part had a link with a part of a tech a sort of technology act, had contributed to the increased attention on the role of assisted technology can have in improving the functional needs of individuals with disabilities. Its passage and establishment of technology-related projects greatly contributed to an increased public awareness in the use of assistive technology by people with disabilities, to improve lives. When the Tech Act was amended, so the Tech Act linked with the Disabilities Act, was originally from 19 in around 1988. So although obviously now in sort of more recent times, so just to inform all of, in more recent times, sort of the use of tech has the use of tech in line to disabilities and long-standing conditions, for example, has advanced. But originally in around 1988, the Disabilities Act had also had affiliation with a Tech Act, and then when the Tech Act was amended in around 19 in towards the mid 90s, in around 1994, it reflected a further redirection in policy away from sort of previous medical isolationist philosophies to philosophies focusing on assisted technology for individuals with disabilities in the context of school work and community settings. Assisted technology should also be acknowledged and understood from employers from employers from employers from employers of individuals with disabilities, allowing more sort of positive work environs. More awareness at the same time is required. So now, just sort of going into the final or the latter parts of this research poster presentation. The sort of latter parts of this research poster presentation. In discussion, a central concern, one of the central concerns to both national and international governments is trying to better understand how effectively to support patients or healthcare service users with a disability and long-standing conditions who can have increasing complexities and complexities. And this has driven this has been this has driven has been this has been sort of driven there has been sort of a driven shifts sort of driven shifts in public policy. One sort of example, although sort of indirect, yet sort of where sort of indirect, yet sort of authoritative, is where discrimination against people with disabilities specifically was in according to in a recording made during a fringe what was referred to as a fringe meeting by one of the sort of main UK parliamentary one of the UK sort of parliamentary parties, and as part of the what was referred to as a fringe meeting in around August 2014, and it was where at that time the Minister of Wealth Reform, who was the Minister of Wealth Reform at that time had informed, and this again, where this is a direct quote, a direct quotation. Some disabled people could be paid £2 an hour, £2 an hour, rather than the full rate of £6 50. £6 50 was at that time the at that time £6 50 was the minimum salary or wage per hour, and so and where the where the at that time, again, the Minister of Welfare Reform had informed some disabled people could be paid £2 an hour rather than full rate of £6 50, £6 50 if they wanted to work. And the statement highlighted some obvious concern, and this and also informed the views that have to become more that also informs the views that have to become more informed, are not always of those of those who have illnesses, or those who have disabilities, or those who are carers, etc. But carers or etc. But unfortunately, of those who are academics, healthcare researchers, employers, and politicians who lack awareness. So one of the questions finally was what can we what can be hoped what can be hoped that can be done differently. So the main message, one of the main sort of messages from this research poster presentation from 2016 is that policymakers should be involved to make more headway to support those with long-standing conditions and disabilities, and to preclude discrimination and ignorance at all levels. And so now some final conclusions. Excuse me. So in regard to some final conclusions, social media usage, for example, has grown exponentially with for example, sites such as Facebook, Twitter, Instagram, and others now representing perhaps more than 20% of time online. Not surprisingly, people with disabilities or long-standing conditions tend to seek tend to or tend to tend to look for experiences experiences that offer advantages over standard forms of accessibility, and offer opportunity for offer opportunity for aligned to healthcare services, and in around healthcare service education. And the use of ICT, and highlighting the challenges of supporting those with disabilities or long-standing conditions through social media, for example, is important, or has been important, because many want to be involved. Many want to be involved to prompt issues like ignorance and discrimination, which can be overwhelming. So Finally, if policymakers are potentially discriminating sort of at top-down level, then what chances do people have at sort of bottom-up level? And so there needs to be sort of a culture and mentality change. That draws this audio podcast to a close. This audio podcast, as part of a Meteor edition. This audio podcast as part of a Biome bullet. This audio podcast as part of a Lobostics Phantom, and this audio podcast as part of a Storm Lobostics production.